Repair of laceration 2.5 cm or less, floor of mouth and / or anterior 2/3 of tongue. Posterior 1/3 of tongue. This is done simply without tissue rearrangement. Repair of laceration of tongue, floor of mouth over 2.6 cm or complex. These may include tissue rearrangement, extensive submucosal suturing, debridement of grossly contaminated lacerations, or repair of through and through lacerations. Repair of laceration, conjunctiva, with or without non-perforating laceration sclera, direct closure. Conjunctiva, by mobilization and rearrangement, without hospitalization. Conjunctiva, by mobilization and rearrangement, with hospitalization. An ocular speculum may be placed in the patient's eye. The physician irrigates the laceration and sutures the conjunctival wound. In mobilization and rearrangement, an extensive conjunctival laceration requires the creation of a flap or graft sutured over the wound, and the eyes are patched to limit their movement while the injury heals. A graft may be obtained from conjunctival tissue of the upper eyelid or from a sliding flap formed following a circumcorneal incision. Extensive repair or repair of the eye of a child may require hospitalization to further limit eye movement. Repair of laceration, cornea, non-perforating, with or without removal foreign body. Cornea and / or sclera, perforating, not involving uveal tissue. Cornea and / or sclera, perforating, with reposition or resection of uveal tissue. The physician removes any foreign body from the cornea with a hollow needle or forceps and the wound is irrigated. The non-perforating tear in the cornea is repaired with sutures. The perforating tear in the cornea and any tear in the sclerum may be sutured. The cornea may be splinted using a soft contact lens bandage. An air or saline injection may be required to re-establish proper ocular pressure in the anterior chamber. If the laceration involves the uveal tissue, the vascular layer beneath the sclera, injured tissue may be cut out or repositioned before the uvea is sutured, e.g., 65285, and the sclera and conjunctiva may each require separate closure. In any of the three procedures, topical antibiotic or a pressure patch may be applied. Repair of laceration, application of tissue glue, wounds of cornea and / or sclera. Tissue glue, also called medical adhesive or cyanoacrylate tissue adhesive, acts as a suture in laceration repairs of the cornea and / or sclera. If the cornea is perforated, the physician may seal the perforation with tissue adhesive after debriding the outermost layer of cornea, the epithelium, to enhance adhesion. The patient may be fitted with a soft contact lens to be worn during the healing process. Antibiotic ointment is applied. A pressure patch may be used. Repair of wound, extraocular muscle, tendon, and / or Tenon's capsule. The physician repairs a deep laceration to the orbital complex. This laceration extends through the extraocular muscles that aid the eye in directional movement. The laceration extends through tendinous attachment of the muscles to the bony orbit and may include the deep connective tissue envelope encasing the eyeball. Each anatomic structure is identified and re-proximate with sutures. The wound is closed in layers. Repair, laceration of diaphragm, any approach. The physician makes an abdominal or chest incision and exposes a tear in the diaphragm. The tear is repaired with non-absorbable sutures. Occasionally the tear may be so extensive that an artificial patch is used to repair defects or reinforce sutures. The incision is closed with sutures or staples, and a dressing is applied. Repair lip, full thickness, vermilion only. Up to half vertical height. Over 1/2 vertical height, or complex. The tissues of the vermilion are closed with layered sutures. The physician repairs a laceration extending through the full thickness of the lip. A laceration or surgically created wound of up to 1/2 the vertical height of the lip is closed with layered sutures. A wound of more than 1/2 the vertical height of the lip is repaired. Closure of laceration, vestibule of mouth, 2.5 cm or less. Over 2.5 cm or complex. The physician performs a simple closure without submucosal sutures or tissue rearrangement. Extensive tissue damage or crushing, requiring complex closure, such as retention sutures, or the closure of a laceration more than 2.5 cm. Repair, laceration of palate, up to 2 cm. Over 2 cm or complex. The physician sutures the wound in a simple closure without submucosal sutures or tissue rearrangement. The physician sutures a laceration greater than 2 cm or one that requires complex closure, such as tissue rearrangement, submucosal sutures, or extensive cleaning due to tissue damage or crushing.